We have a health first alert for you this morning. Billions of dollars in federal funding that health departments have counted on for COVID prevention were put at risk by the Trump administration after they announced they would be making cuts. Yesterday, a federal judge temporarily blocked the move. Merritt Morgan spoke to the Pitt County Health Department and the Council on Aging about how potential funding cuts could impact them. She joins us live now in the studio with more details. Good morning, Merritt.
Good morning, Gigi. Due to the potential pullback of COVID-related funding, the North Carolina Department of Health and Human Services could lose more than 80 jobs and at least $100 million in funding cuts. Those I spoke to say there are concerns about how this will affect the way they control infectious diseases. It's been 5 years since the beginning of the COVID-19 pandemic.
We're going to see cycles of this every year, just like we do with flu, RSV.
And concerns are now rising following the announcement that the U.S. Department of Health and Human Services could lose $11.4 billion used for things like testing, vaccination, and other COVID-19 prevention efforts. Pitt County Health Director Wes Gray says they've already seen the impact the funding cuts can have on their efforts.
Right now, we get about 28% of our funding here at the Pitt County Health Department from the federal government.
Rich Zeck, who works with senior citizens, says the potential impacts on the older generation are also troubling.
Particularly when it comes to older adults who are more vulnerable than most populations. We want to make sure that the most services are available for them, and so always looking at providing extra resources.
Though Gray told WITN COVID funds were already expected to stop at the end of May, there are still concerns that more cuts could be coming.
Child health, maternal health, family planning, HIV, WIC, Women, Infant, and Children program. That's through the Department of Agriculture. So we want to see how that plays out the next few months, if there's any funding cuts to those programs.
That's why Zeck is encouraging people to stay informed.
You know, we want to continue to caution people to be aware. Let's see what happens when it all comes out.
And Merritt, a federal judge yesterday has now temporarily blocked these cuts. This means the funding will now remain in place while litigation over the legality of these cuts plays out. So what does this mean for the future of organizations like local health departments?
Yeah, Gigi, the big concern going forward for health departments will be using these funds effectively while they are available. Gray told WITN the health department aims for prevention, especially with communicable diseases. He says it's very vital to keep programs in place that help catch the sickness early, like tuberculosis, measles, and also childhood immunizations. Now, speaking of, the measles outbreak continues in the U.S., and while there are no confirmed cases here in North Carolina yet, 7.2% of residents in our state have not been vaccinated for the measles. That's according to the CDC. Gigi.
Thank you, Merritt. And to stay up to date, visit the U.S. Department of Health and Human Services website. A link to that can be found on WITN.com. We also have links to the Pitt County Health Department and Council on Aging on our website.